am. I'm tired.
Yeah, me too. Too
But
many
I'm
late nights watching returns.
yes, I'm kind of feeling happily tired today. Is
Yeah.
it's still looking good?
Yep. Yep. It sure is.
Speech scheduled for 5 o'clock today.
5 o'clock.
Okay.
5 o'clock.
5 o'clock. 5 o'clock our time.
Who, Biden?
Biden and Kamala Harris.
Huh. Thought maybe you're going to say Trump too.
Yeah, put them all in the same room.
As long as they're wearing masks.
Councilmember,
Yeah,
would you
as long
like
as
me
they
to
wear
start the recording?
Yes.
Go ahead. Sorry, Kathy.
Sorry to interrupt.
Go ahead.
This meeting is being recorded.
Do we have a quorum, Kathy?
Yes, I believe we do, and I'd be happy to call the roll.
Okay, and
When
that's
you're
where we
ready.
are. Go ahead and call the roll.
Do you want to call the meeting to order?
Yeah, I guess that'd be a good idea, huh? I'd like to call to order the Homeless Strategies Work Group for Friday, November 6th, 2020. It is 1:32 p.m. and we are meeting virtually. So please call the roll.
Barry Buchanan,
Here.
Tyler Schroeder, Carol Frazee, Michael Lilliquist, I thought I saw
him a minute ago.
yeah.
He's
See
here.
him listed. Hannah Stone,
Here.
Seth Fleetwood,
Here?
Riley Sweeney,
Here.
Michael Shepard, Hans Erkinger Davis,
Here.
Mike Parker,
Here.
Nick Lewis, Ann Beck, Karen Burke. I see Jen Daly for Dean White, Lieutenant Cross for Florence Simon,
Here.
Doug Chadwick, Mike Hilly,
Here.
Guy Ochagrosso, Marcus Studham,
Here.
Joel Kennedy,
Here.
Emily O'Connor,
Here.
Michael Barris,
Here.
Lisa Marks,
Here.
and that's everyone.
Thank you, Kathy. Let's go ahead and take a look at the meeting summary from last 2 weeks ago. Would anyone care to make a motion to approve?
So moved.
This is Michael Lilliquist.
Say that again, Ms. Lilliquist, you broke up.
Sure, people know I'm here.
Okay, well, it's been moved and seconded to approve the meeting summary. Any discussion on that? All those in favor say aye.
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 Those opposed say no. Okay, it passes unanimously. Our next meeting is Friday, November 20th at 1:30 p.m. And we'll move right into the meat of our discussion today, and that is on the new strategies matrix that the subcommittee's been working on. So who wants to take this on? Emily? Or Mike?
Sorry, Barry. Give me 1 second.
Okay, sure. Kathy, do we have that we can put up on a shared screen, the new matrix?
Yeah, I'll get that up right now.
Thank you.
Barry, my apologies. I'm here now, but I didn't hear what you asked of me.
That's okay. So we are at our agenda item for the new strategies matrix. And Kathy has now put that up on the screen. We're just continuing our discussion. I was wondering between you and Mike Parker, who wants to lead us through this?
Yeah, so I think where we left this off, Barry, was that you and Mike and I were maybe going to talk about a strategy, and we did not pick that thread up in between meetings. We certainly can. I think we had a start to a good discussion last time, and I think we could probably have a little bit of a discussion here today about which of those. And I don't know, Kathy, if this is your screen and if you could scroll to the part that's about interim housing. But I think that's where it's kind of the bulk of the work of this committee is in those action items and priority areas. So I think it could be worth us having a little conversation today about what we see as the next steps in kind of identifying what action items we want on the agenda for these meetings. And I also want to acknowledge, though, that there's work that's happening. There's work that happens in between meetings within this meeting structure, but also in partner organizations and with our local governments outside of the structure of this meeting. And so I think it's important for us to stay updated on kind of what is happening, but also thinking carefully about the opportunities that this committee has to make recommendations to move things forward and identify priority needs. So I think we could use a discussion here today about how it is that we all together would like to contribute to picking some priority pieces to put on the agenda that with the intent. Right.
Mm-hmm. Yes.
Okay, so where do we want to start this group?
Barry, this is Mike.
Hi, Mike.
I remember too, Emily, thanks for that kind of summary from last meeting. I also remember we thought about doing a ranking exercise, and we talked about we could either do that live in a meeting or maybe set up a method for Homeless Strategies Workgroup members to be able to rank. So, and if Emily, if I'm not mistaken, I think that's one of the things that you and I and Barry were going to talk about just briefly is what would be a good way to do that if we do a more formal ranking exercise.
And is there consensus in the group that feels like how we want to go about this, or do we feel like we would already have consensus on a couple of priority areas that feel super urgent for the next 2 to 3 months of work? Joel, I see you.
I'm wondering if we could revisit the idea of putting this up as a sort of a working document dashboard kind of a thing. Barry, we talked about possibly putting that before the county and seeing if they have the resources to do that, or maybe as a part of this process, each meeting we could do some sort of updating on what's happening at each of these points.
Right. So the three of us need to get together soon, maybe next week. We could do that offline. We could set something up. I'll send you an email after this meeting, and we'll see if the three of us can get together next week. As far as severe weather shelter, I do have an update of what the council discussed yesterday. We're looking at a amendment to the lease with the Motel 6, which we've been using as a quarantine facility for COVID. We have asked to extend that contract into next year, and part of that was also asking to be able to use a number of those rooms for family sheltering. And the Motel 6 management team agreed to allowing 15 rooms to be used for that purpose. That's in the contract amendment. Well, the council, we pretty much didn't. We wanted more rooms. I guess that's what I'm saying. So we have sent that back to them to renegotiate, and then they're going to do it very quickly within the next couple of days, today or Monday, to take a look at how we might be able to get full utilization. That's what we're asking for. It's full utilization of the facility, and to be able to use it the way our health department and our whoever takes over managing that portion sees fit. So that's in the works. We hope to hear on Tuesday. We have another council meeting on Tuesday, and I pressed very hard. I said, I don't want to wait past Tuesday. I want to get this done so we get some of those rooms open immediately. So the health department is working on the management plan for who will take that over, and kind of the criteria of how who's eligible to be housed there, to set up a program. But we're trying to move quickly, but yet carefully, because we just felt we had a little bit of leverage to try to get some more space in there than 15 rooms, and we're going to try that. So, Michael?
Barry, can I ask you a naive question? For those of you working on this particular possible action, is the thinking that it would be one room per family, or let's say there's a family of 5 people, could that be more than one room? Or have you thought about that piece?
That's what the health department is working on now. So no, they haven't even released a draft of that I know of anyway.
Okay.
So I haven't seen anything as far as criteria, but that's supposed to be coming soon as well.
Okay, thank you.
Yeah.
Barry, I have a question.
Sure, go ahead, Seth.
The management aspect. I'm not asking for any detailed information on this, but I'm curious, is there amongst the staff that's working on the management aspect, is there hope? Is it proceeding? Is there reason to believe that aspect, that critical aspect, is going to come together?
Yes, I'm fairly confident. The one criteria that we do know is that the same group that manages the quarantine side cannot manage the sheltering side. It has to be split. So I don't know if that's a CARES requirement or just a public health requirement, but it makes sense. So anyway, that's why we have to proceed with a different management team than what's been managing it for quarantine.
And apologies for this. I just want to make sure I understand. You're reporting that the effort now is to see if we can negotiate a higher number above 15.
Yes.
Good. Yeah.
We're asking for full use of the facility, all 75 rooms, or whatever it is, 76. I'm not sure the exact number. I think it's that.
Fantastic.
So we'll see how that goes. But we weren't going to just lay down and give up and without a fight. So hopefully that'll turn into something that's good. We know we'll at least get 15 rooms, but we can do better than that, I think. Anyway, that's my report for that piece. Has anybody else got anything else? Emily?
Barry, I would just say, if there's, as you watch that process unfold, if there is anything that this group can do to be supportive in seeing that happen, I'm sure I would speak on behalf of all of us to say, let us know if there's something either individually or collectively that we can do that might help get us to that creative outcome that we so desperately need.
Yeah, I think if there was a longer time in between, I would ask for like a resolution out of this group or some sort of a motion. But I think by the time we get through the talking space, it's going to be too late. They may even be doing that as we speak. So,
well, that's good.
Yeah, because we don't want to waste any time at all. Other thoughts on the strategies? That's just one small piece of it. But Marcus?
Hi, thanks, Barry. Yeah, I'm a big proponent still of the pallet shelters. I think they're a wonderful opportunity for us to have reusable shelters instead of just a lease, or even, I mean, if we purchased a property like a hotel or motel, that kind of makes more sense even than leasing them long term. We have this facility. I'm really glad at the decision of embracing that. I'm really glad also that we're going to be trying to use most, if not all, of the rooms. And I would propose that you could easily bring in pallet shelters for lovely isolation quarters, even in the parking lot of that very same facility, if that's what it took. I want you to know that this morning I had the great honor of doing a little bit of a political action with Tyler Bird today. Actually, we wanted to bring one of those shelters to everyone's door. Basically, we were going to put it outside of the county courthouse. And when he came to me with that idea, I of course did embrace that. I want to see that model out there. We were thwarted in that attempt because of course we didn't go through all the processes and everything for permitting. I thought maybe all of you might like to see it outside the county courthouse while it was there though. And so it was there on a trailer parked briefly and did not get assembled. I would ask if I'm glad to have members of the city leadership here. And if you would like to host that someplace where we can all have a good look at one of these, and go in and touch it and with your proper protections, of course, this is the answer, guys. And it's just like the liability to the government is so little when, as far as the assembly time of anything else that you could do. I mean, one day a limited liability company comes in, puts it up for you, and then it's up to up to us to figure out how to run it. So I just want to say that that's really a strong option for us still. We have money for it. Let's not let any of the money burn up. If we can buy some units that we can reuse up to 40 times, I hear more. But it's a matter of assembly and disassembly. And if we can own them, then that means if you buy 50 of them, then you can save hundreds of lives over the years in just a handful of years. Please, let's do it. We have people in the streets. I did outreach last night with my wife and others out there. It's very expensive. I'm really happy that we also had the Calypso Kitchen come forward and give tons of soup, like gallons of soup, and we gave that out in the streets last night too. But I want you to know that it's an expensive endeavor, that our citizenry is out there mixing it up with in a pandemic, trying to cover for all of us. We don't want anybody to die, and we're not going to sit back and watch people die. And we're hoping you're with us on that. And that's why Tyler Bird and I tried to bring that structure to county today. And I hope you can all appreciate the spirit of that. And if you can find a place to host one in a nice visible location that says we're all behind that, I think we should.
Hey, Mark.
Go ahead, Mayor Fleetwood.
Marcus, short of putting it up in a public place, I'm just curious, is there anybody in your network that perhaps they wouldn't want to do this, but I'm just wondering if there was even an opportunity for someone to put it up in a yard. You could let some of us know. We could drive by and take a peek. Is that an option?
It's going to be as far as what the city will allow and everything, but I can tell you that I can think offhand of a great host for something like that who may very well take us up on at least one building that we can look at. You'll be able to see it in his yard when you drive by. But I also think it's a great model for other people to embrace. This particular gentleman has his own bathroom off to the side, and so like there's a toilet in one end of a hall, and then at the other end there's the shower and a sink, and it lends itself to having friends over and camping in your yard for a while. And he offered that to a tent encampment, four different tents that he had room for. Because he was trying to host the medically fragile specifically. And we at HomesNOW at the time tried to place individuals that we thought were good matches for him too. And there's a couple people in their tents right now. They need an upgrade. So yeah, I think we should talk about that, Seth. I'm glad you brought that up.
Other ideas about our either about the information contained in the matrix or our process going forward. I think that, Emily?
Yeah, I wonder if it would be possible for us to, I think we need some ownership of some of these areas. And I think that will help us move things forward. And so I wonder if one potential opportunity would be, rather than collectively ranking them, for example, in that interim housing section, there's 4 spaces. There's unsheltered population, severe weather, youth, and families with children. And I wonder if we had either a few people or everybody sort of pick a function area where we had sort of a subcommittee model, that then those individuals could make recommendations for agenda items and action items to the full committee. Because I think sometimes we sort of have discussions that aren't actually motions or action items. And it would be nice to have a little bit of maybe a subcommittee structure that could make recommendations or bring recommendations forward to the group. I don't know if that sounds like a workable strategy, but I know we have folks who feel really passionate about, different pieces of this puzzle. And maybe that could be a structure that helps us kind of focus in on what are the opportunities and the action items and the ways that this group can support advancing us toward a better community response with youth, a better winter severe weather shelter response, et cetera.
Yeah, I like that idea. What's everybody think? Mayor Fleetwood.
I like that idea too. It's just a practical question. Emily, are we confident we've got the composition of folks that would volunteer to chair the various subcommittees? That's the only question I have.
I do. I mean, I'm sort of doing that with children, right? Families with children. I'm happy to. We've got multiple of us who are really passionate about that issue. But Jen, I'm looking at you. We've got Northwest Youth Services here. We've got Lighthouse Mission. Hans, it's nice to have you today. Marcus, right? Like we've got people with who feel strongly about advancing those issues. And I think if we maybe pull that into a little bit of a different structure, we might find like, hey, our team is recommending this, let's discuss, and then let's make a decision, because that allows us to, as a committee, say like, nope, we're not going to talk about that anymore, or yes, we're moving forward with an action item on that issue. And I think that would maybe help us find some footing to feel like we're advancing some things, as opposed to sometimes just swimming in what feels like an overwhelming problem. So I don't know, maybe it's worth a try.
Yeah.
Very good.
Definitely.
So I've already heard a bunch of people volunteer to do this, so that's cool. Yeah, and I'm going to keep obviously working on what the county's doing to try to increase our capacity through this lease agreement. I think hopefully we get through that next week, and then we can move on to the next phase of that. I know our folks are from the health department today are swamped. That's why they're not here, Ann Deacon and Ann Beck. So they won't be able to report out their efforts on looking for the partnerships that they're trying to find. So we won't get that today, but I'm certainly willing to keep very, very involved in that side of it. So that's 1, 2, 3 subcommittees already. 4, because Michael, which one? Which one do you like, Michael?
No, it says there's 4. There's unsheltered persons, families with children, youth, and severe weather on Emily's
Right, I was
part.
looking for the 4th person to step up. That's what I was looking for. So we got this one here. Whoops, it disappeared. So
to Emily's point, we're interested in and more than enthused to lead the effort for youth. And, I think that there's a lot of conversations going on that don't always hit the radar in these meetings. So we're happy to, if we could use that meeting to kind of keep everyone on the same page of all the conversations that we're having with the folks at the health department and so on, I think that would be lovely. And hopefully we could find some synergy in those conversations too.
Thanks, Jen.
So maybe Emily and Mike and maybe our next step isn't really this ranking thing. Let's organize how we could put these 4 subcommittees together early next week, and then bring that draft plan back to the group and see if everybody's feels good about it.
Great. And I think we could probably, survey folks and ask which function area would you like to hop into? And Kathy, maybe you could remind us paying attention to our limits of how many of us can get together outside of the public meeting. So we are really clear on those pieces as well.
So Kathy, what's our quorum number? Is it 11?
The quorum number is 12. So
We just got to stay under 12.
Great. We should be able to do that.
I would think so.
And as long as you're reporting back with information to the main committee, there won't be a need to notice or post your subcommittee meetings.
Yeah.
Great.
Yeah. Okay, I thought I saw Marcus's hand up a second ago.
Oh, no, yes, but no, that actually sounds like an all really good plan to get that all assessed and then bring it forward. I certainly don't want to leave any of these items unspoken for, and I'll speak up. That's why I'm here. So you bet.
Okay, so I think we got a plan.
Barry?
Yes, go ahead.
Sorry, I am doing this by phone. I can't see what you're doing. I'm actually interested in, I hate to say it, but another subcommittee. I would like to have some of us start looking more at the funding piece for all of these things. I know the county has a lot of resources. I'm having a few conversations over at the city about resources. We have more opportunities on the capital side than the operating side. I'm just thinking whatever idea comes forward in any of those realms, there's going to need to be a funding discussion. Is that a separate subcommittee, or is that like put a pin in it and come back to the topic?
I don't know what exactly it is, but I would love to work on it with you. Because I read your email and I think you have some great ideas, and I want to help expand on that.
I think we could probably, Barry, just include, we'll make sure that the survey tool can include additional ideas for other pieces that aren't covered, and then we can evaluate the best way to make sure that we harness that energy. And I think there's also, there are some other efforts underway within the community that have to do with resource mapping and fiscal analysis that would be great, I think, to kind of make sure we're staying in the loop on all of that. And because certainly all of those efforts also intersect with the housing and homelessness issue. So I think that's a great point. And I think we can make sure we build in enough room to the survey to make sure we collect all those good ideas.
Yeah, yeah. Any other thoughts on the strategies matrix? Okay, we'll move.
Barry, hi, this is Mike.
Oh, Mike, go ahead.
Yeah, just had a clarification around subcommittees. Are we thinking kind of ad hoc, or are we thinking like formally creating subcommittee structure?
Us to do it either way.
It does. Okay.
Ad hoc is probably the easiest.
Right. I think that was my thinking too, is ad hoc might be the easiest. And then a follow-up question, in the Incarceration Prevention Reduction Task Force, the subcommittees do have some capacity to sometimes bring in some other voices. So we should probably talk about that too and see if that makes sense, because there might be some of these subcommittees that could benefit from one or two other folks who maybe aren't strategies work group members. So I just want to throw that out, that could be a way to kind of do some more inclusivity and get some other voices in there.
Yeah, that's a great idea, Mike. I mean, because we do allow that in our subcommittee structure in the Incarceration Prevention Task Force. So thank you. That's a great idea.
Yeah, and we don't have to they don't have to fully commit to being part of it for on and be an official member, right, or be appointed. They can just join the subcommittee. So that could be really great. All right, thanks.
Yeah, thank you. Anything else on that? Michael?
Yeah, I'm sorry for raising these naive questions. I just want to make sure I understand. So Emily's going to send out a survey to all of us as to which, is this correct? As to which subcommittee that we want to work on, correct? And then my assumption is that each of the subcommittees will have a time on upcoming agendas about the items that we have within the committee prioritized for the fastest, most direct action we can take, so that the full group doesn't have to do the full deliberation on every single thing, right?
Yeah, we would have like subcommittee report out kind of a thing, and then some brainstorming around that, I'm sure. But
But
Emily,
the subcommittee would do some of the initial grinding through the issues so that we can move faster.
yes.
Is that what you got? Okay.
Yeah, I would maybe expand on that, Barry, just for a second, if I could, which is that I think some of these discussions, if issues are brought up to us by the public, by, the members of the group, if we can then kick those discussions to a subgroup to say, hey, please look at this issue and come back to us with an action recommendation, then I think that would be helpful for us. So Michael, I wasn't sure if I heard you say that it's just about ranking. I don't think it is. I think it's about kind of owning that function area.
Yeah.
And then bringing any recommendations or action items back to the group is at least how I was thinking about it. So I just wanted to clarify a little bit more of an expansive task.
Thank you.
Yeah. Any other thoughts on our matrix and kind of our process? Mike Hilly?
Yeah, hi, Barry. Thank you. One of the reasons I'm involved in the task force is from an EMS perspective, which is this medical and access to help through the homeless. And I'm just wondering where in that matrix we might be able to position that. I mean, the unsheltered one might be a good spot. But, we're in the homeless camps a lot, EMS, and we see medical things. And I would love to talk how we can bridge to services through EMS or some other type of outreach.
Right, EMS and Grace, and okay, we'll definitely keep that in mind, Mike. Thank you.
Yeah.
Anything else? Okay, let's move to safe parking. Mr. Sepler, how are you today?
I'm fine. How are you doing? Good. Members of the work group, from time to time this happens. We issue a request for proposals. We advertise it extensively. We answer questions received. And unfortunately, when the deadline comes, we didn't receive any responses on that matter. We did about as much outreach as we reasonably could to find a partner. It is not the kind of activity the city is equipped to do itself, and we have limited resources. So we will take our staff time now and put it towards other initiatives that are ongoing, and wholeheartedly hope we can fill other portions of the puzzle with services.
Any comments?
Dang.
Marcus? Comments on that? Emily?
Rick, is that something that do we have an opportunity for something like that to stay open or such that
because it could be something brought out again, but I think it also goes some of the capacity issues, and I think we in this work are very stretched, and it can be challenging to respond to every good idea. But I hope that the process itself was somewhat valuable also for the work group to see that we may have great ideas, and just sometimes it's just the timing. And it's not that it was a bad idea. It just maybe there was nobody there at that time that could pick up that ball. But I want to thank the city and the planning staff for essentially creating a program, a model for something that could be done. And hopefully we can keep that, and maybe it can trot it out again.
Barry, can I speak?
Yes. Go ahead.
So, unfortunately, this is Michael Lillibus. Unfortunately, it is for safe and to go on. The money is free to be used elsewhere. The truth is we had no money for it. We were going to have to dig and find it. So I just want people to know it isn't like there's a bunch of free money sitting around. But if that idea or any other idea comes up, then I think the city does the same exercise. We will look to find money I will at least look to find money for the project. I just want people to realize that it isn't like there's money that's now suddenly free and available. It was always money we would have to find anyway. But I think we have a lot of identified program needs, and in every case, we're going to need to find the money. And I don't want that to stop us from looking. That's my comment.
Hans?
Can I ask a quick question of Rick? Was it location or was it just manager that, or a group that could organize the car parking that was the problem?
I think Mike Parker spoke to it. It's capacity. It's putting together enough volunteers or even paid staff, and finding a location that might work. We didn't have folks who really came forward and said, "Can the city provide a site?" If that was the only alternative, we would have considered whether we should proceed and do that. But we were looking for someone who could come forward. There's a lot of initiatives out there, and we can certainly reissue this. However, absent a response, you move on and say, let's try to get the services for something we can achieve out there. And we're now working on an RFQ for a temporary encampment. And we all agree there's a need for that in the community.
So, Rick, what's the deal with that lower Cornwall stretch that there's certainly a lot of parking going on?
So we provide safe parking by allowing folks to stay in one location for up to 72 hours. If folks have handicap placards, they could stay longer. And we really aren't out there moving folks along unless there's past that time, unless there's an adverse circumstance. So really, we provide de facto safe parking throughout the city. The challenge that we're willing to find is some folks felt uncomfortable being by themselves, trying to be under the radar, lacking facilities. In the Cornwall Street, we have, and I think I could turn to Lieutenant Crass, who's here to talk more specifically about efforts, but we've tried to address the adverse circumstances. I know we had porta potties out there at one time. We had significant problems with the porta potties. It's been a tough one to make work. Some of the folks who are in RVs are just great, and they're making it work. And some of the folks aren't, just like I guess anywhere else in the community. And we have had troubles with the folks who are not willing to follow the basic rules.
Lieutenant Crass, you have anything to add?
Yeah, we do have a street sweeper that goes through there and people move out of the way. It's just to keep it from becoming a hazardous situation. We had debris blown in the roads with the winds. The street sweeper comes, people are allowed to go right back. There's no enforcement done. We do have problems if people like really set up shop there. So that, like Rick said, the 72 hours is kind of what we're looking for people to come as they can and go. But we aren't doing active enforcement down there. It's not a no-go. It's not a complete free zone like that. Some people have heard those rumors, but that's how it's being handled right now. Like I said, street sweepers probably the real only movement.
Marcus.
Yeah, I became aware of that because I was doing outreach and stuff. I became aware that the entire lower half of Cornwall had been posted with those cardboard paster flyers they put out. Said that it would be for 2 days. Nobody should be on the street, and so I reached out to the department. I spoke with Lieutenant Crass as well as others. And this is handled by the Public Works Department, actually. And so that procedure, so I was actually trying to find out if the Public Works Department was even aware of, any idea of something like a moratorium on the camp cleanups, et cetera. Because in essence, what happened, of course, I went back the next morning and they were all gone. There was just one RV and a trailer. It was an RV with a trailer. Some of you have seen that rig around. That one rig didn't move. Everybody else was gone. The only thing that was on the street was all these paper placards blowing around in the wind from the streets, from the actual cleanup. But some people were parked off into side lots, but most of them are dispersed throughout your city now. I rendered aid to them as well. I gave them soup last night late. This amount of disruption seems like something that maybe could be unified in BPD to help control that. I didn't see any human waste in the street or anything like that that warranted an entire street to be cleaned up. And if ever there was a sweep, you had to bring a street sweeper. So that's just the way it looks, guys. It's just what it is. And it's still largely empty. So they're dispersed all over Bellingham now. That's what we get for that. So I'm not harping on anybody. I'm not trying to I'm just trying to bring everybody into compliance with what we're saying we're trying to do and try to keep everybody safe. We're in a pandemic emergency with a winter emergency on top of that, a humanitarian disaster unfolding. Let's do this together. Thanks.
So if I might just to be fair, we sweep streets because when the rainy season comes, we have flooding if we don't clear the materials to get to the storm drains. That's why we sweep streets. We get the leaves up, we get the garbage, we allow water to flow. That's our conveyance, our primary conveyance to catch basins. So it's not a punitive measure against folks camping. It's the way we maintain our storm system.
I understand that, Rick. It's just the end result. What we ended up with was them distributed and dispersed all over Bellingham, and nice big cardboard placards blowing all over empty Cornwall, just the right size to cover every one of your drains. That's what we ended up with. So that's ironically.
Anything else on parking? Okay, let's move to year-round sheltering for families and children. Do you guys have a little report? Joel, you've been working on it, and Emily?
Yeah, thank you, Barry. I'm going to jump in here if you can hear me okay.
Yep.
So, really we've, Michael Barris and Lisa Marks and Emily O'Connor and I have been sort of operating as an ad hoc group under that category already. So we're sort of in the swing of things here. And just wanted to report some of the things that we found just based on our research and sort of bring this issue up in light of current circumstances. And so my part of it, I'm just going to kind of present sort of a state of where we're at and what we're looking at facing here in the next few months. And then Lisa's going to jump in and talk about some of the solutions that we've, and I hesitate to call them solutions because we haven't even really got to that point. It's been mostly trying to identify what's been working in the past. The challenges, what we're facing in the months to come is something we haven't really faced in normal circumstances. We're not in normal circumstances. So there's a couple different aspects to it. There's the emergency need, going into winter to begin with, and then there's COVID, and then there's the increased infection rate with that going on, along with the sort of fallout from the shutdowns early on last spring. So, and then the second aspect of it is that the area that we really want to focus on is more the long-term strategy as far as, how do we get families from homelessness to, back housed in a relatively short amount of time and reduce the amount of trauma that's going on, during that process. And I think that's really our goal. It should be our goal, overall. It's just that, right now we're going to have to turn, our attention toward the emergency problem. For the whole sort of pre-COVID time, we were already looking at, and I'm going to throw a lot of numbers at you, so don't get too overwhelmed. These are just sort of general numbers that I've gleaned from different reports and things over the past months, really, because I've been doing a lot of research on this. But we were already in a situation in this county where 50% of renters were cost burdened, and 30% were considered rent poor, meaning that they were spending more than 50% of their income on their rental payments. So that was pre-COVID. And at the same time, there was a relatively high poverty rate of over 20% in this county. Those are just numbers that I've come across. And if somebody wants to, somebody who knows more about it, has better, more up-to-date numbers, I'm happy to look at those. But at the same time, the rental vacancy rate was less than 1% in this county. So that, that's, on top of that, you've got housing authority and other assistance programs that have waiting lists that are years and years long. These are all things that we all know. So I'm just kind of brushing over it. But that was sort of the tinder for the fire kind of a thing. And then enter COVID, where we've got the workforce widely affected, unemployment rate, even as it stands right now, even though it's gone, it's moving in the right direction. We're at 8% right now, which is already more than double the unemployment rate that was normal before that. With an unknown number that are underemployed, a lot of service providers right now, talking with Opportunity Council and Lydia Place, everybody's working remotely and having to sort of do their normal workload under part-time hours and difficult circumstances. So the state provided the moratoriums to try to reduce the fallout from all of that, to keep people from just suddenly ending up on the streets. Well, that's just kicking the can down the road to, a little bit further and a little bit further so far. Thankfully, we've got until January at this point. But at some point, those have to lift. And I think what we're all hoping is that Congress will provide some sort of relief to that. But there's no guarantee, and we're not really counting on any particular amount or what that looks like. And so there's a lot of unknowns there. So right now, and a little shout out here to Opportunity Council, Jessica and Terry for, just jumping on and giving me some statistics. I appreciate that. Currently, we've got 81 households registered with them as homeless, and approximately 20 of those with parents who are unsheltered. Now, that number is actually down from the previous couple of months, which is, seems pretty good. It's probably, I suspect that's because, leading up to the original deadline for the moratoriums, people probably self-evicted in fear of getting evicted, once those happen, because we all know that once you have an eviction on your record, that's a huge barrier to getting rehoused. So, that's right about this at the 6-month average of 84 households, and that's, I think, Mike, you might agree that's still a little on the high side in terms of normal. And when that fluctuates, when that goes up to 100 or more, that gets fairly burdensome already at this stage. So what happens when the moratoriums lift? We end up with landlords who are losing patience and money on these situations where they're basically having to sort of hang on and wait for some money to come through. I suspect that in January through March, we're going to end up with a flood of evictions, assuming they don't extend the moratorium further. And then eviction of those with mortgage forbearance is going to be delayed maybe 3 to 6 months after that. So there's going to be 3 to 6 months of sort of ongoing self-evictions as well as forced evictions. And so based on my calculations, just trying to get numbers, and the numbers are what are called squishy numbers, because it's really hard to get a lot of any kind of solid data, especially under the current circumstances. Based on my calculations, we're looking at possibility of between 100 and 1,000 households could either be evicted or self-evict within the first 3 to 6 months of next year. I'm going to repeat that because I know that's a lot. 100 to 1,000 households could be evicted or self-evicted within the first 3 to 6 months of next year. So the best case scenario is 100 people over 6 months. In this sort of range. The worst case scenario is 1,000 people over 3 months. My gut says that's not going to happen, but it's probably more likely in the middle of that. So anyway, I don't want to take any more time. I just wanted to throw that out there and sort of as a wake-up call to what we're facing possibly next year. We're looking at least a doubling of the number of households that are unhoused and even living on the streets. And that's at the very least that's going to be a big burden to sort of overcome. At the worst, it's going to be catastrophic. With that said, I'm going to turn it over at this point to Lisa, who's going to talk about some of our attempts at trying to identify partners and models and things that could move us toward addressing that, definitely in the long term, and hopefully even maybe, we can get together with these institutions, these organizations to come up with short-term as well as long-term solutions. So Lisa,
thank you, Joe.
I'll hand it over to you.
Okay, thank you, Joel. In light of what Joel was just talking about, yeah, that's one of the things that we've been working on in our subcommittee is looking really across the country at different models that could possibly work here that would be more sustainable to help come up with some best practices and things that have worked in other areas that could possibly be implemented here rather easily, stuff that's already working. And in doing so, I've talked about Lehigh before, and we talked with them again because they have been talking about partnering with a organization that is here that's been doing some things in our community, and that's Road to Home. And you guys had mentioned earlier, which is kind of ironic, about bringing in some outside voices that could maybe speak about some of the best practices and different things that they've been doing that they would like to bring here and partner and work with other organizations that we have in our community, because we know that working together works. And I think the more organizations and the more folks we have working on these things that can come together, the better it could be. And so we have Melissa Bird from Road to Home, and Bradford Gerber from Lehigh, otherwise known as Low Income Housing Institute. And so without further ado, I will maybe open it up to them and let them talk about it, because I know we're running out of time and I was going to give them a little bit better introduction, but since we're getting a little pressed for time, I'll just let them kind of speak on what they have been doing and where they see that they could help in our community.
Hi, thank you, Lisa. Thank you, everybody, for having me. My name is Melissa, and I'm a nurse, and I'm certified in case management. And so that's how I ended up getting involved with our local homeless population, because I was trying to figure out what resources were available for my patients. And so I wanted to let you guys know I have been looking at your strategic matrix, and as a case manager, I saw there was a huge case management deficit, and that was really important, at one point a priority. And I know, and it's very difficult to help folks through these systems. And so we looked elsewhere, and we found that there was a program down in LA from Union Station. They do a community ally program, and it was very similar to stuff that we were already doing as volunteers in another organization, kind of pairing up volunteers with people experiencing homelessness, volunteers who are not case managers, but could totally help people connect to service providers and almost be assistants to their assigned case managers. So therefore, maybe we could increase the capacity of the trained case managers with people in our community that want to help. The other thing I realized is that people in our community that want to help might not have the resources that they need to communicate effectively, to understand trauma, ACEs, and those types of things. And so we received a grant from the Whatcom Community Foundation, and we want to, we'll have free training. We're completing it right now, our training content with a licensed mental health therapist and other case managers in the community to teach people to be volunteers and how they can be helpful to folks in Bellingham specifically. And we want to make volunteers not just for Road to Home, but for all of these agencies. And then we've been looking at best practices because we know we need more housing, where everybody knows that. And I don't know how to do that. They didn't teach me that in nursing school. So I looked down south, and I met up with Bradford Gerber about a year ago from the Low Income Housing Institute. They've had a lot of success with tiny home villages and cottages and other housing down there, Bradford specifically with the tiny home villages. But they have agreed to partner with us to work on a housing project here in Bellingham. And potentially, you know, maybe we could bring more housing and be part of a longer term solution, not just an emergent solution. Go ahead, Bradford.
Yeah, thank you for that introduction. And thank you to everybody in this working group. It's really an honor to be on this call with people doing such important work in Bellingham. As Melissa mentioned, I'll also just provide a caveat. There's a saw that's going on in the background where I am. So if at some point there's a saw that anybody hears, someone's on a miter saw. Yeah, as Melissa mentioned, I work with the Low Income Housing Institute. We've been in the space of affordable housing development and management for about 30 years as an organization, predominantly doing affordable housing in multifamily settings. So we have about 2,500 units of affordable housing in the Puget Sound area in 5 different counties in Washington. And as of about 6 years ago, we started on the tiny house project as it now exists in Seattle. We now have 9 villages in the Seattle area. We have 2 in Tacoma, 1 that's currently under construction, and 1 in Olympia. So in a very short period of time, it's been just such an honor to kind of learn beside and be a part of a program that's grown pretty quickly and been learning from other regional best practices. I think we all saw Coyote Village as it was starting down in Olympia and kind of learned and had a lot of creative thinking. So from kind of original grassroots, our program has grown pretty quickly. And we're now quite a robust both social service, development, and site operations organization. So we're, you know, we play a role in the Seattle area as one of the most sizable shelter programs, predominantly getting community-based referrals. We have villages that range in size from 14 tiny houses at their smallest to as large as 52 tiny houses at their biggest. There's a variety of different staffing models in our programs, serving folks that are more interested in self-management programs where there's less staff and there's more resident engagement towards security duties, on-duty shifts, chores in the village, to villages that have quite robust behavioral health resources and full-time staff to serve folks that wouldn't be able to make it in a more self-managed setting. So our program has grown really to try and meet the needs of everybody that's in search of shelter in the Seattle area. So as Melissa mentioned, it's really just an honor to be on this call, both as maybe a resource if folks are interested and have questions about how we've been successful with tiny houses, what our best practices are. We try to share that information as willingly as we can and kind of treat all of our data as open source. That would be from the tiny house designs, which we do have posted on our website and we provide to everyone. We give all of our builders creative liberties, but really try to, as they're doing construction. So almost all of our tiny houses are built by students that are in training in carpentry. We always try to kind of like go at, from a joint perspective, both the lack of affordable housing and shelter, as well as the lack of easy transitional programs that get people into meaningful wage construction jobs. So tiny houses have been a really successful route in that way. We have programs that go as far north as Marysville, The Tulalip Tribe Tarot program has built more than 30 of these tiny houses with their students. The RAP program is currently building in Marysville, and as far down south as Thurston County, where we've had some folks that are building. So it's really a regional approach, and our conversations with Road to Home have been, I think, just really creative and looking at how can the region continue to expand, how can more best practices spread, how might we be able to play a role both with those best practices and just wanting to hear within the community what tiny houses might mean. So yeah, I think just ending it there. I'll also, if there's not enough time for questions, definitely include my email into the chat box. So if people would like to reach out individually, please do. We have presentations that we give. I can just send a PowerPoint full of pictures or anything else if people are interested.
Okay, wow, thanks guys for being here. Melissa and Bradford, that's awesome. I don't want to let this opportunity slip by without being able to ask you guys some questions. So let's go with Michael Lillquist.
Bradford, thank you. I've been familiar at a distance with Lehigh for a while, and I'm really appreciative of all the work you do. With regard to tiny home villages, you said you had a variety of versions of models. How would you describe where they fit in best in kind of like the whole ecosystem of housing? Do you think they're best as low barrier shelters? They're best as kind of like permanent supportive housing? They're best as transitional? Is there a particular place or need you think they fill compared to other housing services or programs?
Yes. I think all the above. You know, tiny houses are, even though the namesake of a tiny house is by far its most quote unquote catchy article, it is the thing that gets people thinking about, you know, creative spaces, small spaces, downsizing. I would say that it can just mean so many different things. So we're working on cottage projects right now. So those are fully permitted permanent structures. We're funded by the Department of Commerce on an affordable housing project that we're doing in Seattle. And those are 450 square foot tiny houses. We're also working on villages that have 96 square foot tiny houses. And even within there, there's just so much diversity between demographic of residents that we can serve, families to, you know, and I think this is maybe where I would lean to answer the question is that for folks that have been outside for a long time, for whom traditional shelters do not work, for people who are really interested in staying with their pet and staying with their belongings, and for whom a traditional shelter, again, it just might not work for them. And that would, I think, typically tend more toward single or couples that are outside, some of whom have substance abuse issues or mental health disorders that would make it very difficult for them to access shelter resources. I think we've seen a huge success with tiny houses in that way. And of course, requires behavioral health, requires additional kind of help on site. Just because it's tiny houses and it's private space doesn't mean that we don't need all the resources that we can muster for folks. But I think that's where we've seen, you know, a really tremendous success is the ability to provide for people, you know, a locking door when they maybe have not had a locking door for their entire lives. Really is just a huge transition. But I don't think that there is such a straightforward answer. We have villages where they serve predominantly families, and I think those have also been really successful places. We have villages in parts of Seattle that are very quickly gentrifying, and local community connections where folks that are, you know, potentially rent burdened and, you know, on the way of being gentrified out that are currently homeless in those communities or really just skating by couch surfing, they can stay there, and these villages can become a vehicle to fight against displacement. So there's so much creative thinking, and I'd never think as someone who's not in Bellingham to answer that question. I think that's for folks in Bellingham doing this work to know.
Hans.
I know the aim is to find housing for folks that come into tiny homes. Do you have a rehousing rate that you have?
We do. So we're we're contracted with the Human Services Department in Seattle, with, you know, essentially with the equivalent in Olympia and in Tacoma. In Seattle, which is where I live and can speak most knowledgeably to, we're held to a standard of 40% of exits into permanent housing. Last year, we were at 55% of exits into long-term housing. That's different village by village. So the number of folks that actually exit in a village varies. It may be a 50% turnover rate in occupancy in a year, but we do maintain at all of our villages above that 40% exit rate into housing, and sometimes higher. I think in particular in villages where there are families, that's the case. I think that really just speaks to how important it is that there's a case manager that's on site. Usually a tiny house village, if it has, say, 40 tiny houses that are there, there would always be at least 3 that are for folks that are working on site, so that there's a place where a case manager can meet with someone in private, or there's maybe an open space so that folks that are in the community, we have connections with a lot of the local health clinics. One of the traveling nurses could come through and spend a day a week in one of the tiny houses, providing health services to some of the clients there. So I think that's where we really see that as a positive benefit. When we've added case managers from 1 full-time staff to 2 full-time staff in a village that has the same number of folks, we've seen that rate go up. So it's quite connected to case management to client ratio.
Other questions? Well, we really appreciate you folks being here with us today, and look forward to more discussions. Thank you.
Yes, thank you.
Thanks.
The next item on our agenda is winter shelter, and I had already reported out on our 2 ANs from the health department are not here today, and then I did report out on the Motel 6 situation. So I'm not going to spend any more time on that. But if anybody have anything else before we go to public comment? Michael Lilliquist.
Yeah, this is maybe out of order or premature or jumping the gun a little bit, but I'm going to be suggesting, I suggested you, Barry, the county look at this. I'm going to suggest that the city looks at earmarking some of our real estate excise tax money. Normally, real estate excise tax is used by the governments to pay for their own infrastructure. The legislature, however, does allow now for the next few years a portion to be used for the building or rehabilitation of housing and for facilities for people exiting homelessness. This is, I say it's premature because money without a purpose is no good. I think this group is talking a lot about the purpose. I'm trying to move forward also on the money aspect. I think it's a great idea. I hope other people do too. But I want to make clear that this is money for the facilities, not for operations. And I think what we've seen is that finding the staff who are trained and qualified, finding the human resources and the operating resources may be the next big lift. We need physical locations, we need the capital to rehabilitate them, and then we need operations. I just wanted to let people know that I was looking at that aspect, and when this group does, you and I, whoever else want to get it, pull aside, talk about the funding piece, that's one of the pieces I think we need to include. It can't solve all of our needs. Like I said, it's got a string attached to it, but it can solve maybe some of our needs as seed money or leverage money. Thank you.
Yeah, Hans.
Just one more thing before public comment. In a couple of weeks, we'll be putting a survey out that we're starting to do where we get input from the community on our 3-year strategic plan. So we want just be looking for that in your inboxes because it'll come to you as well. We also survey a lot of our consumers, folks that are using our services, to get consumer voice as well. But we take those notes very seriously as we work out our strategic plan. Just giving you a heads up.
Thanks, Hans. Okay, well, why don't we go ahead and open the public comment period. And Kathy Halko, do we have anyone with their hands up?
Yes, we have 3 attendees with their. The first to speak will be Doug Gustafson, followed by Heather Katahdin, and then Sherry Laboff. Go ahead, Doug.
You guys hear me, right?
Yes, we can.
Yeah, hi,
okay.
Doug.
Hey, this is Doug, chairman of HomesNOW, not later. I just wanted to report that Unity Village continues to run smoothly and safely and continues to evolve and improve. Within the last few weeks, 3 of our residents have found housing, and we have added some new residents. Over time, our rehousing rate continues to go up. HomesNOW keeps track of these statistics regarding exit results of our program. Since HomesNOW has operated Unity Village, Safe Haven, and Winter Haven, 49 people have exited the village and encampments. This number does not include the people who are currently living at the village, only exits. With our last resident finding housing, HomesNOW has just reached the important milestone of a 40% rehousing rate. This means that 40% of the people who come through find long-term housing after they are done living at the village. We will continue to push the envelope, make progress, and we absolutely can do better. I am encouraged to see the numbers moving in the right direction. These results have been achieved through a model of self-sufficiency and self-management. In other words, the villagers run the village together, working with board, staff, and volunteers to get the best results for daily life at the village, as well as helping people who are into permanent housing. HomesNOW has no paid staff, and the whole village costs around $1,500 a month to operate. Residents willingly donate monthly based on ability to pay to cover the cost of utilities. We have 3 on-site managers who are also residents, similar to an apartment complex where management often lives at the apartment. However, we encourage residents and staff to be upfront with each other and speak to each other directly when issues arise. What HomesNOW mostly provides is a stable place to get things back together so you can move on with your life. We try as hard as possible to keep it simple, make sure people are freed up to do what they need to do. This means they spend time working to improve their own outcomes without unneeded interference or too many hoops to jump through internally. I recently saw a City of Bellingham budget meeting in which Planning Director Rick Sepler mentioned an estimated cost of a tiny home village for their RFQ, request for qualifications for city sites. In the document, it was mentioned that operations of such a village would cost anywhere from $300,000 a year to $500,000 a year in operations costs. I would like to remind the work group that operating Unity Village, the first tiny home community in Bellingham, costs around $1,500 a month, around $18,000 a year. For any future villages, though, we realize that some sites might need infrastructure to get started, and we'd appreciate if the city was able to provide that. We intend to apply to the city's RFQ, and we are making the argument that we are qualified to set up multiple tiny home villages because we offer the most bang for buck in terms of being able to shelter homeless individuals for a cost of near zero with good results during a time of tight budgets and increased need. We have proven over time that we are sustainable. As the only tiny home community currently operating in Bellingham, we are also the only agency in town that is operating a tiny home village at this time, and so we have a solid track record locally as well. The only thing we can't afford at this time to buy is land. If there's a site available, though, either through the city or the county or a private landowner, we can get started right away as soon as we are able to get through the updated permitting process and as soon as the city or the county can identify some sites for us to apply to. We move very quickly. We are also urging the council to amend BMC 20.15.050, Section C, to allow tiny home communities to be authorized to operate for 5 years instead of 2 years. This will keep more people housed and off the streets now and into the future. We're a partner. We're ready to do more. Please consider it. Thank you.
Thanks, Doug.
The next speaker is Heather Katahdin, followed by Sherry Lapoff. Go ahead, Heather.
Hi there.
Hi, we can hear you. Go ahead, please.
Heather Katahdin speaking, tax-paying resident since 1989, retired healthcare clinician and past volunteer first responder and firefighter. First, I want to express my gratitude for our citizens that see and assist our most vulnerable, unsheltered citizens experiencing homelessness, and my gratitude and respect of the work of frontline staff at the PAD of Northwest Youth Service and the frontline staff at our primary staff base camp, coordinated by Lighthouse Mission Ministries, and the board and the volunteers of HomesNOW Not Later. And I can sense how each member of this work group is doing your best, given the limited weekly our staff has, and I appreciate the efforts of both city and county council. I can sense a collective shift to think out of the box and create a new shelter capacity as soon as possible this month. I'm requesting that we as community create a nighttime warming center that is welcoming and accessible to all ages and all genders. Citizens need to know a precise, warm, and safe location to go to during our winter months when our current shelters are at capacity. I'm speaking as a citizen witness. Per what I witnessed outside in the dark, cold streets of Bellingham, may the records reflect our current shelters have experienced full capacity over a week ago. I witnessed an unsheltered female citizen on Sunday, October 25th, being told by the staff at our primary county shelter in Bellingham base camp that they were full and at capacity of 200 people. On that cold night in Bellingham, I witnessed communications to both an elder woman over 50 years and a female youth who was 17 years, both who were told, quote, "I am sorry, I can't let you in." The 17-year-old female youth, Miss Sabrina, was also told 18 and older was only allowed inside. The older woman, Miss Julie, was also told late at night, "We are at capacity, 200 people tonight." With care, the staff brought her water as she was thirsty. Later, I phoned Northwest Youth Service for Youth and listened to a recorded message with no directions given for youth in need. I did locate the PAD, a special night center for youth ages 13-17, but they shared they were at overnight capacity. Staff there does good work, and they stated they would do their best to any youth who came to their door that night. But that night, I was sadly not able to ensure either gal had a place to stay and be warm. I did not have any location I could bring them to stay warm at night, and there was not an accurate shelter hotline number nor an accurate county website that would let me or let any citizen in need of shelter from the cold know what public building would be unlocked and open to all when needs for warmth and safety emerged late at night. I support the efforts to bring tiny pallet homes to our community. I respect the work of the board and volunteers of HomesNOW, Not Later. May we as community members see the needs before us each day this winter. May we greet each other and share our attention and warmth. Thank you so much to the staff and the committee members and volunteers in this community. Have a good day. Thank you.
Thank you for being with us, Heather.
The next speaker is Sherry Lapoff, and if any other attendees would like to speak, simply click on the hand icon to raise your hand virtually, or if you're joining by phone, dial *9. Go ahead, Sherry. Sherry Lapoff, go ahead, Sherry.
Oh, I'm sorry. I didn't unmute there. So I'm Sherry Lapoff. I've attended many meetings over the last year, and I'm a volunteer with HomesNOW. One thing is I want to note that this week is going to be 32 and 33 degrees at night projected, and that's when flesh freezes. I know 2 people in the homeless community who have no toes from exposure. One does walk, one is in a wheelchair, but they have no toes because they have frozen repeatedly. Everything that we've talked about today is right on. I agree with it. I support it. Very, very happy to see it. But we need, these people need shelter on Tuesday, and we haven't approached that. The pallets can go up. The pallets can be up by Tuesday. I'm being a little facetious, but they, in theory, can, but pallets can come up very quickly. They also have many advantages. One of them is that they are separate spaces. There is nobody in one great big COVID room. So these address the COVID explicitly, and as well as many other issues. Marcus, I will really help to try to get one downtown where people can see it and see how well it works. But what absolutely took my breath away was the estimate of 100 to 1,000 families being having to pay rent coming in January. And we know that they are not going to be able to pay rent. And you know what we just talked about, those people are going to go, I'm guessing they're going to their families, a couple of family members, couch surf, garage surf, extra bedroom surf for a couple of months, and then they're going to hit the streets. And right now what we're saying in this meeting is that the safest place for safe parking is Cornwall Street. We haven't mentioned a single place for people to go in vehicles to be safe. There's no bathroom there unless they're at the very end by the beach, and there's not garbage there. But that's what we all need to tell families if they're asking where to go. The safest place in town, it is Cornwall Street. So just think about even 50 families, even 20 families in a vehicle, an RV or a car. They're in cars. We find them in cars every winter. Mom and dad, 2 kids, a mom and 2 kids and a baby. There are infants on the street. I've called the hot team a few times about knowing that there were infants around, and we just need to get it together and all have the same response is yes. Cornwall is the safest place in Bellingham for a family with children to camp. Anyway, thank you for listening and thank you for the meeting today. Appreciate everybody.
Thank you, Sherry. Is there anyone else wishing to speak?
There are no other hands raised at this time.
Okay, we will close the public comment period. And any final thoughts before we adjourn? Joel?
If I could just thank Sherry and Heather for their comments as well, and just say, sort of follow up with the numbers that I shared. Again, they're pretty wide estimates, but what's clear to me is that we're facing a crisis for sure, and maybe even worse than that. if you can, I can't quite grasp obviously the upper end of that range. It could actually be more than that, but what that would actually look like, but it would be catastrophic to this community. And of course that depends a lot on on what kinds of aid come through, whether from the federal government or the state or both. But like Sherry mentioned, people are going to find ways to cope. They're going to be couch surfing or whatever for a little while, but those numbers that I calculated even took that into account. So that 100 is pretty, in my mind, pretty solid in terms of the bottom end of people who are going to be on the street. So that's, I'm hoping that serves as a wake-up call to us to start thinking creatively and really, getting something going.
Marcus?
Yes, I just want to urge you all to please reconsider and trying to keep into your consideration, keep in your vernacular, in your mindset, how valuable a reusable tiny shelter that you can palletize, put on a truck, take away, put it on another site. They build in half an hour if you know what you're doing. We need these, and then we can have them next year too. We can't keep throwing money around the way we do on hotel rooms, everything else. We're lucky to have the Motel 6, and I do urge you to fill those rooms. Bring in tiny homes for isolation if you need it. Same lot if necessary. Work it out. But we've got to do something now. We're in an emergency on top of an emergency, and I thank you all for your time. This has been a really a good meeting, and I thank you all for your time and energy. Thanks.
Yeah, Joel?
Sorry, Marcus just reminded me of something I was going to ask earlier. Does anybody know what the story is with the Motel 6 up in Ferndale? I think that's
I don't know. Riley, do you know anything about that? Is Riley still here? Yeah, he is here.
I do not have the latest details on that, so I don't want to speak out of turn.
Yeah, last time I drove by there, it looked like that was shut down. So I don't know
It was closed down last October for health department reasons, and I do not have the latest update since then.
Anything else before? Everybody, it's a great meeting today. I think we're organizing ourselves for action, which is awesome. And Emily and Mike Parker, I'm going to send an email out to try to set up a meeting with you next week, right after I get off. So everybody have a great weekend, and we will see you in 2 weeks.
Give me shelter.
Thanks, Barry.
Thanks to our presenters.
Thank you.
The recording has stopped.